Welcome to another edition of Inspired Stories, where leaders share their experiences so we can learn from their successes, how they've overcome adversity, and explore current challenges they're facing.
Welcome to another edition of the Inspired Stories podcast, where leaders share their experiences so we can learn from their successes and be inspired by how they've overcome adversity. My name is Anthony Codispoti, and today's guest is Kelly Oliver, Chief Human Resources Officer at Nevada Health Centers, which was founded in 1977 and is the largest provider of primary care for underserved populations in Nevada. As a nonprofit, they operate 20 health centers and 5 mobile health programs across the state, offering services like dental care, family medicine, pediatrics, women's health, and behavioral health. They make quality healthcare accessible and affordable through a sliding fee scale. With initiatives like the Mammo Van and Ronald McDonald Care Mobile, they bring care directly to those in need in urban, rural, and frontier communities. Kelly joined Nevada Health Centers in February 2023 and has been instrumental in fostering a positive workplace culture and enhancing employee engagement. He holds an MBA in International Management from Thunderbird School of Global Management and dual bachelor's degrees in Management and Finance from the University of Utah. With extensive experience in human resources leadership, Kelly has served in roles at HCA Mountain Division and Regional West Health Services. He also holds certifications including Senior Professional in Human Resources, SPHR, and Certified Scrum Master. Now, before we get into all that good stuff, today's episode is brought to you by my company, Add Back Benefits Agency, where we offer very specific and unique employee benefits that are both great for your team and fiscally optimized for your bottom line. One recent client was able to add over $900 per employee per year in extra cash flow by implementing one of our proprietary programs. Results vary for each company, and some organizations may not be eligible. To find out if your company qualifies, contact us today at addbackbenefitsagency.com. Now, back to our guest today, the Chief Human Resource Officer at Nevada Health Centers, Kelly Oliver. I appreciate you making the time to share your story today.
Hey, thank you so much for having me, Anthony. I appreciate it.
So, Kelly, as I look at your work history, before you got into HR, you were doing something radically different, risk management, information systems. Tell us how that leap took place.
Sure. And when I was in college, when I was deciding my major, doing management, things like that, management was kind of fun and I enjoyed it, but I wanted to push myself. And so I was working for American Express at the time, and I was doing banking and, credit and that sort of thing. And I really loved the credit side of things, and I really loved working for American Express, but I kind of had dabbled in employee engagement a little bit in college and where I was working and that sort of thing. But I really loved risk management and that sort of thing. And I just challenged myself to get a double major. I thought I might as well double major, and it's just, a little bit more work. But I really enjoyed being in the kind of the activity of risk management and doing credit and banking and things. But yeah, it's probably not a traditional HR background, for sure. Half my career was kind of in banking and risk, and then here I am in management.
And so what led to that transition? Why did you decide I'm going to shift gears from risk into HR?
Yeah. So back in 2000, about 2008 was when I made the jump over in HR. What led to that was the fall of the market, the housing market, the bubble bursting. So people here say the bubble burst in 2008. Well, when I was at the bank, I was doing risk management for a subprime mortgage portfolio of about $4.5 billion.
Okay. Yeah. I see where this is going.
And so what I kind of realized in about midway through 2007, I was at a credit conference, and one of the instructors at this credit conference had said, "Hey, how's what's your mortgage ratios looking like?" And I was like, they're not looking so good, and he's like, let's look at this. And so I started realizing that we had the market was kind of hitting an iceberg, like the Titanic almost, maybe a major iceberg, but I really knew what we were doing internally but I had a hunch that the market was probably going to go soft, sooner or later. And so it was a rough time.
So you had a front row seat to everything that was going on and actually knew much sooner than almost anybody else that this
Yeah,
was
the
about to hit.
indicators were there: the
Okay.
bankruptcies, the repossessions, the foreclosures. Seeing people not being able to pay their mortgages and things, or there was a lot of back then. There was a lot of adjustable rate mortgages in the marketplace, and there was also really weird things happening in mortgages, like drive-by appraisals and stated income loans, which is like they didn't verify your income and things, and so
Wow.
people were kind of betting on their future that they were going to get raises and things and be in a better financial spot when their adjustable rate mortgage set, the indicators were there. And so I was kind of, management was like, thinking that, nothing's going to happen, don't worry about it, and just keep working, and I'm like, hey, the numbers were getting worse every month. And so I knew I had to get to a better place. And so I decided I was going to, see if I could use my management degree and maybe do some human resources type stuff and get out of there.
Okay, so you saw the writing on the wall. You got out before the bottom really dropped in that industry.
Yeah.
And did you find your way to HR right away, or was there sort of a bridge between there?
Yeah, so I was able to get a job as a project manager and at a healthcare company, a very large healthcare company. I was driving to work one day. I saw this big sign. They were opening up a hospital. It says, "Hey, we're hiring," and here I was depressed about the mortgage market, and so I applied for a job and. They offered me a job as a project manager, but they also knew I had this like employee engagement background from my previous work. And so my boss was like, "Hey, I'd really like you to help lead employee engagement in our department." And so I, jumped in doing my project management stuff, but the employee engagement kind of on the side. And I started getting noticed by corporate on initiatives we were doing for employee engagement. And so one of the vice presidents reached out to me after a couple of years of being a project manager and said, "I really want you on my HR team." And so I joined the corporate HR team of this healthcare organization. It had about 36,000 employees.
So, what did it look like, the employee engagement work that you were doing? Why was this? Why was this getting you so much attention?
Yeah. So I don't know if it was the leader I was working for, the division I was in, but they had really poor scores on their employee engagement survey, just their annual employee engagement score. And I was like, well, we can improve this, like we can have a little committee on the team, I had done a Six Sigma, Greenbelt project for employee engagement years earlier on working through issues with employee engagement and stuff. And so when that came out that I had kind of, I guess you'd say, maybe mastered or improved employee engagement through a Six Sigma Greenbelt project, people were kind of perked up a little bit. And so that's where I was able to implement some changes. And so we went to the top of the company, with our scores the next time we took the survey. And so people were like, "How'd that department go from the bottom to the top in 1 year?"
Wow. And so, like, what were some of the practical things you mentioned, like forming a committee? Give us some other examples.
Yeah, having the leader be a little bit more open to, meeting with employees, showing a personal side, recognition was big, to recognize employees, for daily things, and then for projects completed, and making having some meaningful messages to employees, like sending a personal, card, to them, writing, thanking them and stuff like that. And so, that meant a lot to employees, and, it changed the atmosphere, changed the environment.
Yeah. So, how did the opportunity for Nevada Health Centers open up? What led you there?
Yeah. So, I was in Nebraska, working for Regional West Health Services there, a couple of years ago. And, it was the organization kind of went through a rough spot financially, but also the culture was really poor, and I had learned some things about some of the executives and things that were not in line with my values of honesty and being trustworthy as an executive, and so I started to look for a job, and one of my friends who was actually the head of human resources here was taking a job in another state and called me and said, "Hey, you ever thought about Las Vegas?" And I really hadn't. And he said, "I think you'd be incredible to come work for our organization," and I'm, he was leaving, and so he, introduced me to the executive team, and it was just a really amazing relationship that was quickly formed through meeting with them a couple of times. And the CEO is a phenomenal guy and a leader that walks the talk, and it was just really refreshing to see it. He's very visionary too, and he offered me a job on the spot and said.
Wow.
He said, "Hey, Kelly, I want you to come. What would it take for you to come join us in Nevada?" And so it was easy for me to say, "Hey, I'm on board." But I really love the healthcare space.
What is it that sort of bonded you and the CEO so well? I mean, you mentioned he walks the talk, but what does that mean
Yeah.
in this environment?
Um, you know, so he's been with the organization for over 10 years now, and he came into the organization when they weren't very financially viable, and he's taken and expanded this company from you know maybe 10 or 12 clinics to now 20 clinics, and to having mobile units and being able to serve the homeless and low income people across the state of Nevada. But he has similar values to me, accountability and mutual respect and trust. And, he likes, ideas of, let's go improve our culture. Let's go do employee engagement. Let's meet with our employees. And so he and I, every year we go meet with every employee. We drive to every clinic in the state of Nevada and meet
Wow.
with our employees, and just listen to them and just talk to them for a couple hours. But it's important to us. We call it the CEO Let's Talk. And so we just go and listen. But it's a guy I want to follow.
So tell us a little bit more about Nevada Health Centers and what it does. There's now
Yeah,
20 locations. It's
sure.
primary care. You're serving the homeless. Who else? Kind of paint us a
Yeah,
picture.
yeah. I kind of give a little rundown sometimes when I'm, in an interview, when I'm interviewing other people, and kind of laying the company background out for people. But yeah, Nevada Health Center has been around for 40 years. We have 20 clinics, so that's 20 medical and dental clinics around the state of Nevada. So from the far northeast side of kind of Elko, Nevada, if anybody knows the geography, over to Reno, Carson in the western side, and then all the way down here in the south in Las Vegas. And so we do have medical and dental clinics, also behavioral health services and social services. And one clinic that we have here in Las Vegas is in our homeless corridor. So we work with the city of Las Vegas and some of the county programs in the homeless corridor to provide medical care and social services to the homeless people. And it's really cool to see that. And one of the programs that we have is called Street Medicine. And so we have EMTs who go up and down the streets and see homeless people and see if they need just aspirin, or if they need help, medical care at a clinic, or emergent, to get them an ambulance. And those people are just kind of like the Mother Teresa's, if you will, of healthcare. That they're just like kind of in a dangerous spot, because you don't know what you're getting with some homeless people, but they see what kind of care they need and assess it, and then they either get them to our clinic or to a hospital and that sort of thing. But it's really rewarding work. And then our 5 mobile units that we've expanded to, that was a vision of our CEO as well. So we have 2 mobile medical units and 2 mobile dental units, and then we have a mammogram mobile that does breast cancer screenings. And so they'll show up in a very small town in Nevada for a day and do breast cancer screenings. And so last year we did over 3,000 breast cancer screenings, and we helped 16 women with early detection of breast cancer, and they were able to get care quickly, and haven't had any problems since then. And so those are the really cool stories that I love to share with people. Is like, hey, we helped 16 women get care very quickly, and possibly save their lives. And the homeless story is great with the street medicine. And then just being here in our clinics as I visit the state with medical and dental and vision, and another cool program that probably isn't well known as school-based medicine. So if your parents don't have insurance, but you are a registered student between the ages of 4 and 18, you can get medical and dental care, and then the city or the county reimburses us. So kids don't go without medical care. So.
Wow.
And then another side, I always have to put a plug in for these guys, but we do the Women, Infant, Children program in Las Vegas area. So we're the largest administrator of they call it the WIC program in a lot of states. And so we do about 23,000 encounters a month for women and children, helping them with breastfeeding and baby formula and nutrition for the mom and the baby. And so that's another part of our business that a lot of people don't know that we do. But we're the largest in the state because Las Vegas is the biggest population. But we have 23,000 encounters a month on that program as well.
Wow, that's really impressive. The school-based care that you're talking about, the care isn't actually delivered in a school setting. Am I right? Like they would still come to your facility?
Do. So both. We do go to the school. We do have a couple of school clinics we go to and so our providers will go there and our like a nurse practitioner or a doctor will go there for a day and 1 day a week and do medical care at the school. But they also come to our medical clinics as well for more than maybe immunizations and things like that. So.
And how does somebody qualify for that kind of care?
Yeah, and so for like school-based, you just have to be a registered student in one of the school districts.
There's no kind of minimum income requirement or maximum income requirement, I should say.
I don't think so on that one. I'm human resources. I don't know all the billing, but our front office associates, when anybody walks into our clinic and needs care, they have an assessment that they do, and so we have that like sliding scale. So based on your income and things, have the fees there. And then if you don't have any insurance or any income, we also have some programs there that we help you, get Medicare or Medicaid and work through those programs.
As we talked about in the intro, there's a sliding fee scale there.
Yeah. So it's really cool. So whether, if you can't pay it all or you can pay some we provide, we don't turn anybody away. So,
the folks that you're overseeing that are helping the homeless, you call them like Mother Teresa, right? They're in a little bit of a dangerous spot. From, an HR perspective, I don't know, how do you think about positioning those folks so that they can be where they need to, helping the people that need the help, but also ensuring their own safety?
Yeah. And so, we provide them with, cell phone and different things like that for protection. We brought on this street medicine program about a year ago, and because we just had the homeless program, but it really dovetailed nicely having the street medicine because there was an existing program, and the organization that had it was ending their wanting to run it. So we took it over, but I went from just having medical clinics and mobile trucks to, okay, I need to provide a coat, and a beanie or something, because the weather gets a little cold down here in Vegas, believe it or not. So providing some gloves and, coats and things like that so that our employees, are warm and that sort of thing was kind of new for me, in this space. But, we have some protocols that we follow, they go in pairs and that sort of thing. And, there's ways to inform, if they get into a risky situation or anything. But yeah, our homeless clinic does have like bulletproof glass in it in the front and things like that. There's, yeah, things we have to do to protect our employees a little bit.
Yeah. So you guys have grown to 20 locations, and I get that this may not be your exact area of purview, having, be the head of HR there, but I'm kind of curious if has that growth happened by acquiring existing centers or just going into new locations and sort of starting from scratch?
It's been a little of both, and so we've opened up a couple of clinics since I've been here, and most of those have been where maybe a community, a city or a town will reach out to us and say, we need some medical, care in our town, and so then we assess it and maybe meet with their city council or their town council and discuss that, and work through some things like that, and so we've open up some clinics in some smaller towns that way. And then earlier this year, there was an organization that was here that decided to get out of the they call it the federally qualified health center space. And so they were shutting down a couple of their clinics. And so we decided we take on one of their clinics. And so we basically acquired their space. But yeah, it is a lot of involvement with communities and city councils and also the government, to see if we can. We look at the kind of the population and the need for the healthcare, and if there's not any healthcare there, and can we go into that space?
Do you guys have future growth plans in the works?
Yeah, we're always looking at it. There's a lot of places in Nevada that we're not yet, and then some small towns, and so it's always on the table to look at it and see what makes sense, and see what we can do from a funding perspective. So we receive a lot of funding from federal and state grants and things, and so yeah, we're always looking to do that if it makes sense with our company and our vision and values as well.
And when you go into a new location like that, from an HR perspective, how do you prepare the company to kind of hit the ground running, have the best people in place? There's a big smile there.
Sometimes we get a short runway, like, hey, we're going to open up a clinic in 3 weeks. You're like, whoa, so let's just hurry and post jobs all over the place. We've been lucky. We recently opened up a clinic in the town of Pahrump, Nevada, and the lady that's our clinic manager there actually is pretty well connected, and so she had a lot of friends from a previous clinic that she was working at. So it's leveraging those relationships. But yeah, sometimes you would really like a little bit longer runway to be able to post jobs and but yeah, we do have to look at being competitive pay. So we're kind of look around and see what other companies or organizations are paying for similar positions in the area and stuff. So we kind of get it right the first time or as close as we can, and then make adjustments. But yeah, it's advertising and, working with, people who know people that might be looking for a job and that sort of thing. So also working with, trade schools and, places that are maybe, training medical assistants, and getting them certified and, needing, someone wanting a job after they're done with their schooling and stuff. So
mostly direct hire. Do you do some contract or temporaries?
Mostly all direct hire. Yeah. We just have some contracts on the provider side, like on the doctor side, but on regular employees, non-providers, it's all pretty much direct hire.
What's typically the hardest position for you to fill?
So a lot of the turnover is in medical assisting and front office. It just turns over. It's the frontline employees, entry level there. Providers is hard to recruit for to come out and work in Nevada. Sometimes in these small towns, but providers is a little bit tough. I work with the provider relations vice president, and so she has a tough job of finding providers who want to come and work in a small town in Nevada. But
when you say providers, you mean doctors,
nurse practitioners, physician assistants.
Yeah. So when you find somebody, you've got them in house. what are some things that you found to be successful to retain them or hold on to them?
Really good question. That's another thing I love about our organization. We have what's called Nevada Health Centers University. And so for all employees in their first year of employment, they're given online courses and web courses with one of our organizational effectiveness directors. And they have a number of courses that they take over that first year. And then we have a first year celebration for them. If you're a leader in the organization, like a new manager, new director, we have a manager cohort, like new leader cohort that's about 10 months long, and you'll do some courses there. We're really big on crucial conversations course through Vital Smarts. So we encourage every employee to go through Vital Smarts crucial conversations course. And then for physicians, we have a physician steering committee, but we also have a physician leader program that we're working to provide mentoring for our new graduates that are providers, maybe just out of school, be mentored by some of our existing providers. So we do, and then this also, our university has a couple thousand different courses that you could take for like self-improvement and stuff that you want to do, or like if you want to learn Excel or learn to be a better communicator, things like that. You can go do that at any time on that platform.
And this platform, it's free for all your employees to access.
Yeah,
and it's not like they're earning a certification that might like increase their pay. They're just doing it for their own edification, their own self-improvement.
There's both out there actually.
Okay.
I mean, they can. They're mostly it's self-improvement stuff, but you can earn a certificate. And we also are like our 1-year program, you get a certificate, and then our physician leader training stuff and our manager thing. We provide a little graduation and a little, excitement around it, celebration. But all of our employees can do that anytime they want. But we recognize them when they do go through a certificate. Some courses do provide you like a certificate and stuff. So
okay. So that's a pretty cool program. Are there other examples of some unique initiatives that you've led to kind of foster a more motivated and commitment workforce there at Nevada Health Centers?
Yeah, we do twice. So we contract with a group called Huron Consulting. It's if you're in the healthcare space, you might have heard of Quint Studer. He was kind of I don't know if you call him the godfather of healthcare, like management or whatnot. But Huron, acquired his knowledge of healthcare and that sort of thing. And so we do what's called a leadership development institute twice a year. So usually in the spring and the fall, where we bring all 70 of our leaders together for usually 2 days of training on some things operational, some things leadership and management. And we just did one in October. And we talk about different topics and things like wellness came up this time, compensation. We sometimes pepper in like 5 dysfunctions of a team learning, or, the 4 agreements type book, things like that, and some guest speakers and things. So we do that every twice a year, about 6 months in between. So it's been really good to keep our leaders, knowing what's going on in the organization and help them with their skills and, being sharp.
So you yourself, you double majored. You've got at least a couple of Six Sigma belts. So degrees, certifications, some of the education opportunities that you're providing to your employees there. Also, some of them come with certifications. How important do you think those degrees and certifications are, either for yourself or for your workforce in general?
Yeah, I'm a believer of, I live by a quote that says we should all plant trees we'll never sit under. I like to help people, and sometimes that's helping people that you don't even know, or just, giving to people. But whether you're an HR coordinator or you're an HR director in my organization, I want everybody to be the best. I did a little bit of time in the Marines right out of high school. And when I was in the Marines, I always said, you're only as strong as your weakest link. And I really believe that. And so like I said, if you're my HR coordinator or HR secretary type position, I want to get you indoctrinated into HR and provide you an opportunity to get like an HR certificate that whether you stay with us long term or not, you can always have that on your resume that you have an HR certificate and things. And so I firmly believe in training and leaving the world a better place. And so our positions, we try to help our medical assistants be certified in different areas of the company and their positions. We try to help people be the best at their position. And, I want people to be able to, like I said, if they, decide to leave the organization, they'll be able to say they had a, HR certificate or a medical assistant certificate on their resume and help people with not just, while they're here with us, but for the rest of their life.
Because you believe those certifications are going to help them get noticed in a crowded job space.
Yeah. And you never know what's going to happen with, the world or organizations, and for myself, I always, I was the first person to graduate from college in my family, but I felt like if you have a degree, nobody can take that away from you. You can have a lot of work experience and that might be good and all, but I think having a degree, can, you can fall back on it if you need to. It's not ever going to, and like a certificate, even a trade certificate, from a trade school, you can't take that away from a person. So,
Kelly, launching new programs like the clinical trials partnership with Javara, that shows growth, shows innovation, which we've already seen examples of it here in our conversation. I'm curious from an HR perspective, how do you prepare and support your staff for that kind of expansion and integration of new services?
yeah, I'm smiling a little bit because I remember when we were talking about clinical studies and research about a year and a half ago or so, and it was working with an outside organization to come into our organization and partner with us. And we were like, oh, we're allowing this other organization. And, from an HR perspective, it was like, okay, we got to, make sure that everybody meets the same immunization and background check and drug screen, all that stuff, But looking at the future and also the potential that it provided us to help more people. I was told that there was one of our research studies, the medicine and stuff that's in that program, if for people that can't afford it, it was like a $30,000 treatment, and because they were able to sign up through our research, clinical study, they got that medicine for free, and that's really cool that a low income person could come to us and we say, hey, we have these studies going on, and be able to give them some medicines and stuff that they might not be able to afford otherwise. And but from an HR perspective, it was like, okay, it's another kind of maybe stream of revenue, if you will, into the organization, but also it expands our services and what we can offer people. Like I said, with the $30,000 example, really cool things there to help people get care, and then also maybe be on the cutting edge of treatments as well.
Obviously, in HR, a couple of the key roles that sort of fall under your umbrella are hiring and firing. Let's talk about the hiring piece first. I'm curious, from all you're obviously an innovative guy, you like to be kind of on the cutting edge of things. What are some things that you found have been really helpful to kind of weed through applicants and get a sense beforehand, as much as possible, nothing's 100%, but as much as possible, to be able to weed out people that are not going to be a good fit from a cultural standpoint?
Yeah. I think sometimes it starts with also like your job description or your job posting, like, being as transparent as you can in what you're looking for with the position, so that, when people send you a resume or, send you the application, apply online, you can see if they have that experience. And pre-screening is very important. Because if you start having an interview with 10 or so people, involved, that adds up in money, or is, time away from the work and stuff. But one thing, we do panel interviews is important. There have been, when I first got here, there was some leaders that were just doing, their own like one-on-one interviewing and stuff. And these people were turning over, these positions were, turning over pretty quickly, or the people weren't a right fit. And so we did have to, let them go, terminate them early. And so I've said, hey, we need to do panel interviewing, because if we can get more people involved, even HR, if we can be a part of the interview, we can, lend a lens that, maybe the operations team doesn't see, and so it is like that culture, like we can ask some cultural questions from HR and some background questions and things. And so having a good panel interview, and maybe I tell people, like, you do it at phone screen, right? Maybe 30 minutes. You do an interview for an hour, and then you make a job offer. Maybe that's not enough time. Maybe you should have a phone screen, and then maybe 2 rounds of interviews, for getting to know someone for a couple of hours. But asking those questions. Also, believe it or not, we do reference checks on some of our positions, and that's actually been very informative to us, and can give us some information. It's, some people are like, oh, those are, way old, people don't do reference checks anymore, but we do some reference checks, and it's been telling sometimes.
Now, I'm kind of curious from a legal perspective, as an employer of somebody who has, left and gone on to other opportunities. Somebody calls me and asks for, a reference. What is it that I'm allowed to say? Is everything like on the table?
Well, so like if employer wise, most organizations, it's just, if you were to call up their former employer, it would just be like their dates of employment, what position they held. There's really not much information there. But if you give me, a character reference of yours, like a former boss, or somebody that worked for you, things like that, and provide a character reference. Sometimes people have reference letters and things that they'll provide us. And sometimes people's willingness or not willingness to talk about a person can also be telling. But yeah, there is restrictions on, what you can and can't ask. Some companies have it in their policy on what they will share or not share with another organization.
So are there different like state and federal laws surrounding that, or is it just like a policy that each individual company would set up typically?
I'm familiar with a lot of the company policies, because we'll say this is, if you're terminated, when we let somebody go, we say, if somebody calls for a reference, this is all we'll share is you worked for us from the dates and your position, that sort of thing. I'm sure there's probably some laws there out there.
All right. Yeah, I've been called for references before, and most of the folks who have worked with me in the past are great. So I'm happy to go above and beyond and give a glowing recommendation. But I remember one time in particular, I got a call about somebody who was, not somebody that I could give a good reference to, and I didn't know what I was allowed to say. So all I kept saying was, I can confirm their dates of employment.
Yeah. I mean, because we'll ask the candidate, hey, can you provide us with 2 or 3, reference people, so they kind of know they're going to get a phone call, and it's a little, that way it's a lot easier, But yeah, we wouldn't just call. Some applications would ask, write down your previous leader and their phone number on that job application. We don't usually go that route. So.
Gotcha.
Yeah.
You guys ever use? Sorry, go ahead.
Oh no, go ahead.
Do you guys ever use personality assessments for any of the positions that you hire?
There's been talk about it. I've worked for organizations that do have personality, but we currently don't here.
Do you have an opinion on them?
Well, some of the assessments can be really long, and take a lot of time to fill out. But I've seen some good things come from it in terms of situational interviewing, based on how a person filled out that assessment. The one assessment tool we used would provide us questions that we should maybe ask, or areas that we should, look for or try to bring out in that candidate. So those are pretty cool. So.
What, looking ahead, Kelly, what kind of future plans do you have for the HR department there? Are there other programs or innovations that you've got in mind that you want to roll out?
Yeah, and I think it's not like anything grand, I would say. We haven't had a wellness program here that got off the ground. They've talked about it for several years. I've heard about it. We're just getting off the ground with a wellness program for our employees. Just started this month, and running into the 2025 here, we're excited about that. Recognition is another thing that I want to improve on our anniversaries. 5, 10, 15 year. Recognizing that, making that a little bit more special for employees. Communication is an area that I think that we can improve on in terms of, letting our employees, I say, does the water get to the end of the row? Do all employees, get the message, so working on some communication initiatives for next year. I just believe that, employees can have a connection with their organization if they get a little bit more communication. And what that looks like is, we have like a newsletter that's put together for our board of directors meetings and things. And I'm like, well, why don't we just add a couple of things to that, like recognize some anniversaries and some good call outs, and let's send it out to all of our employees, not just the board of directors and executives, but let's get it to all the employees, and so those initiatives are right there in front of us in the couple of months, with recognition and communication and going forward.
You mentioned at one of your previous positions, really being able to increase employee engagement scores. Is that still something that you measure there with Nevada Health Centers? And if so, what does that measurement process look like?
Yeah, we are. We're switching over right now from one vendor. We have Press Ganey, is kind of the healthcare space for patient experience and employee engagement. Switching over to Qualtrics here actually this month for patient experience, and then our next employee engagement survey. We currently do one annual employee engagement survey and then one mid-year survey. I've thought about doing a quarterly pulse survey. I've been in some organizations where you just send out 8 to 10 questions once a quarter to employees, so you can kind of have a little bit more feedback, some data points throughout the year. But yeah, employee engagement's really important to me. I'm the type of HR leader that I don't know if you want to hear this, but I'm a guy who dresses up as Santa Claus or the Easter Bunny and goes out and visits all of our employees in the clinics and visits our patients. And it's kind of fun. I want HR to be a place where people want to come to. It's not just a punitive place, or they're afraid to talk to HR, earlier this summer, when it was 115 degrees here in Vegas, I bought a snow cone machine, a commercial snow cone machine, and we had this little collapsible wagon. We'd pull up to a clinic, put in our snow cone machine, roll it into the clinic. We'd make snow cones for all the employees, and I'd just say, hey, I want you to, cool down on a hot summer day, and so we had, different snow cone syrups and things. And I just try to engage with our employees, and let them know we appreciate them. And sometimes it's the small things that go far. I come in as Santa Claus and do different things, but it's fun. Like last Saturday, we had a Saturday clinic. We're not usually open on Saturdays, but we've been doing medical clinics at a couple of our locations on Saturdays, and so these 15 or so employees are working hard on a Saturday. So I just put on my Santa Claus costume and popped in and took some pictures with the patients and the employees and stuff. And but that's important to me, to engage with our employees as a people leader.
Yeah, that's fun stuff. Shifting to not fun stuff, firing, letting folks go, that obviously falls under your umbrella too. Mm-hmm. For those folks out there listening, maybe they don't have a ton of experience with it, but they're in a leadership position where that's something that they need to do. Do you have some advice on how to approach that?
Yeah. So a few years back, I think her name is it Angela Duckworth? She wrote a book, or no, is it Angela Duckworth? So hers was grit. Sorry. There's a book called Radical Candor. And it's a book that I really like. And it talks about being able to have conversations with people about things that are, maybe going off the rails, as they come up. And so organizations that can have radical candor can, say things, hey, Anthony, this isn't going so well right now. We need you to improve, or, kind of what's going on in your life. But just being open with your employees. But when it comes to, problems and issues, what we allow, we enable, and so as a leader in HR, I always try to be factual. I tell my employees in HR that are my business partners, what are the facts? What are we dealing with here? Because I can't affect someone's employment without the facts. I need hard information. So I kind of use a couple of models. One is called FOSA. It's the facts, objectives, solutions, and actions or consequences. And I kind of try to frame my conversations with people that way. What are the facts that happened? You've missed work, a couple days or whatever. My objective in talking to you is to improve your attendance. Our solution is, kind of like
is for you to show up.
Yeah, the solution to show up, right? And then your actions or consequences is, you'll be probably written up or even terminated. And so I try to help people. That's a very simple way to talk to people. But first off, let's talk with people. Let's find out something's going on in their life. That's kind of where I'm talking about radical candor. Like why have you been late the last few days or something? Is something going on in your life, or is it road construction? Whatever it is, you hear different things. And then if it gets to, I believe in like coaching and counseling, kind of in that level, being human with people. And then if I have to ramp it up to, the formal documentation. I would tell people address those issues, because the good performers are going to see you as a leader that doesn't address the poor performers, or, someone that's continually, making a ruckus with the team, and those good performers are going to leave. They're not going to want to work for an organization or a team that is just enabling bad behavior and stuff. So it can be I don't mean it in a bad, I mean it respectfully when I say it can be a cancer if you don't address it, and it can eat up your team and stuff. But addressing those behaviors, being real with the employees, like, hey, what's going on, and then like, hey, because I talked to a doctor a couple weeks ago, and there was some what was brought to me was that the doctor's doing all this stuff. It's crazy and all this stuff. And I hadn't had any prior conversations with them. And so I said, well, I'm going to go over there and meet with them in person and just talk with them and just kind of find out what's going on. And by going there, talking to them, finding out what's going on, I said, hey, this is kind of what I'm hearing. What's going on? And we talked it out, and I learned about why things were happening the way they were and stuff. And the provider sent me a letter, an email, a few hours later, and said, thank you so much for just listening to me and hearing my concerns and things. And I'm like, sure, no problem, because I said, before I ever want to impact anybody's employment, with a written warning or final written warning, things like that, I want to, hear what's going on and see what the facts are.
Is that difficult for you to do with so many employees and so many different physical locations?
We are situated pretty well here at our organization, because I've got 3 regional or HR offices. We've got Las Vegas, I've got one in Carson and one in Elko, and I have HR people in those 3 locations. And so if something's going on at a nearby clinic, they can drive over there. And so my HR business partners are able to geographically take care of the state of Nevada that we have there. And then oftentimes they'll bounce ideas off me or tell me about a situation and ask for a recommendation. So,
you ever have to deal with somebody getting aggressive or violent during a termination?
Yeah, sorry, I'm laughing. I shouldn't laugh at that.
Hey, what else can you do?
I take security or people's, security, very seriously. And so I I sometimes plan for the worst, because you never know in this day and age if someone's going to have a gun or physical violence and things like that. I've had people over the years, come across the table and try to go after their leader, like try to strangle them or things like that. I kind of assess the situation. I sometimes, think about having a couple of people on standby, in case, outside the room or things like that. But I do think security is important, and I do try to plan for it in our terminations, and making sure there's backup, if you will.
That book that you referenced, Radical Candor, the author is Kim Scott.
Kim Scott, I heard her speak at a conference, and I got this book, and I just it's great. It just tells us, like, because some leaders are afraid to have a conversation with people, and then they'll let things snowball out of control, and by the time they talk to a person, it's like a big dumpster fire. And so what she's saying there is, like, we should be able to just sit down with you and say, hey, here's what's going on today, and that sort of thing, before it has to be formal. And I think employees respect you for sitting down with them. And like I had that provider example, they respect you for just sitting down and talking to them about things before you just come walking in with a formal document. And there are times, when people clearly break the policy or detrimental to the company, where you just, sexual harassment or something like that, you
gotta start with the document.
You gotta start there. But if you can, on those other situations, be human about it.
Yeah. Kelly, what's a serious challenge you've had to overcome, either business or personal? And what are some lessons that you learned going through that?
Oh, wow. I probably both sides of the things. I'm a deep value, like, values run deep with me. Like having honesty and integrity are very important to me. And when I see people that are maybe bucking the system, or and sometimes at my level, you'll see some peers, some other executives, not at this organization, luckily, but when you see people acting unethically, that disturbs me, and I don't want to be there. I've actually posted out of a job before because I didn't want to work with that director and vice president because they were just unethical, and that sometimes conflicts me a little bit. I know one time, well, I don't know if I should get into this, but there was an HR experience where I had been, some information had been brought to me about an employee that was doing pornography on all over their company computer and things. And and we're talking over 1,500 images on their computer during work time and on their company computer. And this employee was a high performer and the organization. And so I took it to my leadership. I said, this person needs to be let go. And my senior leader said, we're not going to let that person go. They're a high performer. They bring in a lot of money for the organization. And I was like, if this was any other employee, they'd be fired immediately. And, so sometimes my personal values, and, the leader's like, you need to just stand down on this. And I was like, I can't, man, but I did, but sometimes your personal values can sometimes conflict you a little bit, but you want to be with organizations that match your values, and that sort of thing. So that's, sometimes a challenge there, to, have your personal values and boundaries, if you will, a little bit. Challenges for me, personally. Oh, wow. But, so back in my early days of my career, I was like 22 years old. I was working at a grocery store. I was a manager. I don't know if you've heard of Albertsons grocery stores. Maybe you have. I was wanting to be a store director. I was on my way, and we used to apprehend shoplifters in the store from time to time. And I was assistant manager. Employees come up to you and tell you that guy's walking out the door with all these groceries, So as assistant manager, you go after this guy. Well, this guy, as I was waiting, I got this guy, but he decided to, he heard some sirens that weren't even, cops don't turn their sirens to come for shoplifters. But anyway, this guy was triggered by some sirens. And as, we were waiting for the police to come, he kicked me in my back as hard as he could twice. And I used to say, let them hit you first, because then it's kind of self-defense or whatever. But he got 2 good kicks off in my back. But anyway, I ended up having back surgery.
Wow.
I spent 90 days off of work. I mean, this guy pushed out 5 of my discs in my back.
My gosh.
And but it was a life-changing experience for me because I was having back surgery at age 22 and 5 discs that were bad. In the grocery business, you lift a lot and things, and you move around a lot. And it was a time in my life where I decided, what am I going to do with my life? I can't to be a store director. You're going to have to continue to lift and do all these different things, lifting groceries and stocking shelves, things like that. And I decided to apply for a college scholarship. I was laying in the hospital bed, and I was just like, what am I going to do with myself? And, someone said, well, maybe you could do some vocational rehab or whatever. But so I went and applied for a college scholarship, and I was given a scholarship to go to college, and it changed my life. I had to learn how to walk again during those 90 days. It was the most saddening thing I ever had to deal with, because when you have back surgery, they take all the muscles and tendons out of the way to get down to the discs.
Wow.
And
There's
they have
a lot
to
of recovery there.
They have to reattach themselves. And so for like 3 weeks, I had to have my wife roll me over, because there's just it's not attached yet. But I was depressed. And, but when I found out about, maybe going to college and stuff, I was going through rehab, learning how to walk again. And I was just like, okay, maybe God's telling me I need to do something different with my life. And so, I went to college. I made the most out of it. First started out at the community college. I got an associate's degree in business administration. And then, my next goal was to get my bachelor's degree. And while I was there, I thought, hey, it's not that much more to get a double. And so I got a double finance and management degree. And then I took a year off, and I was like, I should get my master's, and just keep rolling up here, keep setting the bar for yourself. But that was a personal, challenge for me, was, physically to do that. Also change kind of, I was in high school in the grocery business. It was just kind of running my blood, and I loved it. But God, kind of wanted, saying there was something else you needed to do. And so I went to college, and just I've kind of set goals for myself, since then, in an early age, and accomplishing, career things, and to keep, I always think I'm not at a destination right now. Yeah, I'm the chief human resource officer, but I think it's still a journey. It's continuing to learn. It's continuing to see what's out there in the marketplace of HR and, laws and things that are changing and stuff. And so I'm on a journey still, and I will probably be on a journey till the day I retire. But I think it's good to keep learning, keep setting goals for yourself. I'm probably not going to do any more education in terms of a degree, but certificates, or things like that are important to me to kind of keep challenging myself to keep continuing to grow.
Always be open to growth and learning new things.
Yeah.
I had a guest on very recently that referenced a book by Ryan Holiday called The Obstacle is the Way. I'm not sure if you're familiar with that one. But basically, it's like the hard thing that you're going through now is actually what is, to kind of paraphrase, is what's going to open up the next opportunity for you. And so for you, you were all in on the, on Albertsons. That was that was in your blood. That's
company
what you were
man.
Right. Yeah. And then you had this, horrible back injury and this back surgery that took you out of that. If it hadn't been for that traumatic event, these other doors, probably couldn't have opened, or you wouldn't have seen them.
Yeah. And, I think having some resiliency, there's been challenges in my career, there was probably, I don't know, 8 years or so ago, a new vice president came in and said, I don't want half of your HR team anymore, and reorganized us out of the company. And it was a setback for me, in my career, because I was an HR manager and, thought everything was well, in my life. I've never been terminated or laid off before, but that was the first time I was laid off, and said, we're reorganizing you and half your team out of the organization. And, you couldn't find, you apply, all the stuff you do in HR, applying for jobs and interviewing. And I probably applied for, I know, over 100 jobs, and you get some interviews and you get excited, and then it doesn't work out, I ended up working 2 jobs for a short time. I'm not afraid to say it, but in 2018, I worked at FedEx at 2:00 in the morning till 8:00. And then I went to this HR job that I got that was, didn't pay as much as my other HR job yet, but I had a wife and kids and responsibilities, and I didn't want them to suffer. So I worked, 90 hours a week for almost a year. It brings you to your knees to just, get on your knees and pray, but I just kept going. I'm like, hey, things will work out, and it did. I was, almost a year, and I got a call from HCA Healthcare and said, I applied for a vice president job, and, they called me and said, we'd like you to be our vice president, over the Mountain Division. And, and to not have to work 80 to 90 hours a week was just amazing, but I'm very grateful for the experiences I've had. I'm grateful for the kind of the determination I have, and to not be, deterred or depressed, for very long. Sometimes that, you get to, don't, life's peaks and valleys, don't stay in the valley very long, stay on the peak as long as you can, I've had to work hard, had some setbacks, but, now, being chief human resource officer, it's really cool. And I love to help give back. Like I said, make sure training is happening for our employees at all levels of the organization. And, we're only as strong as our weakest link. And that's how I want our organization to be.
Kelly, I've just got one more question for you, but before I ask it, I want to do 2 things. Everybody listening today, I know you love today's content. Please hit the like, share, subscribe button on your favorite podcast app. Kelly, I also want to let people know the best way to get in touch with you. What would that be?
Yeah, LinkedIn's an easy way. If you just want to Kelly Oliver on LinkedIn, Nevada Health Center is on there. You can message me out there. It's my email address here at work is koliver at nvhealthcenters.org. But yeah, that'd be an easy way to reach out to me if you want. And personally, I give you my personal email too if you want. It's oliverkelly01@yahoo.com. But yeah, I send a daily quote to 100 of my friends around the world every morning. So I could add you to the quote list if you want.
What was today's?
Today, here, let me look real fast. It was really, let's see here. Go to my sent real fast. Today's daily quote is, it's by Greg Anderson. It says, if you're going to doubt something, doubt your limits. So I make a quote up. I get quotes and I send them out to my friends around the world every morning. So,
all right. That's fun stuff. Last question for you, Kelly. What do you see the big changes are that are coming to your space in the next couple of years?
I think AI is big. Everybody's talking about AI, people using it for interviews, or using it to write their resumes. I see some good things from it where it can help write policy or help us, establish policies. I don't know if, we can edit them a little bit, but I think that it can help. It can help and hurt us. Maybe it's kind of like the internet when the internet came out. There's good parts of the internet and bad parts of the internet. But I think AI is going to be big. There seems to be lots of people wanting to work from home still from COVID, so there's these, a lot of people wanting to work from home. I see a lot more work balance that work-life balance, where people are going to, not necessarily maybe want to be leaders in an organization because they want to do things, So I'm seeing that now with things. So people are asking to work less hours, maybe 32 hours a week, so they can have 8 more hours, of life, and stuff. But behavioral health is a big thing that I'm hearing and seeing a lot from employees, and working through behavioral health issues is getting a lot of attention.
If you could wave a magic wand in the AI world, what would you like a tool to do for you?
Oh. Answer all my emails. No, just kidding. What would I like it to do? I just want it to be truthful. I want it to be honest. Like if someone's using it to write their resume, I hope that they be honest. But I think just have some integrity. Just the AI have integrity in what it's doing.
Well, Kelly Oliver, I want to be the first one to thank you for sharing both your time and your story with us today. I really appreciate it.
Sure. It was good to talk to you and think about some things of my past and stuff and share that with people. Hopefully it's inspiring. And if anybody ever wants to chat, I'd be happy to check them out. Or if they want to come down to Las Vegas and catch a meal or something, come on down.
All right. There you go, folks. Open invitation for a dinner.
Yeah.
That's a wrap on another episode of the Inspired Stories podcast. Thanks for learning with us today.